It happened to be my 30th birthday when we got my last pregnancy test that was negative from our 4th IUI cycle. I had a bottle of wine and sat in the bathtub and cried my tears away, and it was that day that we closed the door to IUIs and decided we were going to do IVF, and we were just going to have the family we wanted and go in a different direction. Eric and I had both just finished residency, and I had just started training in my infertility fellowship, and we were newly married, and Eric and I had just decided that we wanted to start trying. So we stopped our birth control, and pretty quickly after stopping it, I had this idea that something was not quite going as according to plan. At the beginning, I thought, I'm an infertility doctor, I've got this, I can figure out what's going on for myself. And I realized really quickly that you have to separate being a patient and doing your job. And so I had to go and see an infertility doctor myself. About 6 weeks in, I still hadn't had a period. And then another 8 weeks in, I still hadn't had a period. And about four months after stopping my birth control, I still didn't have a period. And that's when we discovered that I have polycystic ovarian syndrome. They recommended we start with doing some processes to help me ovulate and then proceed with some insemination cycles. And we did that for 4 cycles without any success. I remember the very first night of my injections, and I teach people how to take these injections, and I doubted how to give them to myself, and I ended up spilling half of the injection on the ground because I was so nervous about giving it to myself. Despite the physical difficulties of going through the IVF process, on the day of my egg retrieval, I walked into it with confidence. I was actually at that point excited because I knew that what we'd done thus far hadn't worked out for us, but I was so confident that this would go well. No, I cheated and did it by myself because I didn't want to tell him it was negative. We had finally gotten what we wanted, and it was positive, and I immediately picked up the phone and called him and told him, and he was so excited, a little frustrated probably that he wasn't there with me, but so happy that we'd finally gotten what we wanted. Having Auburn and Nice were just an amazing journey, but we decided we wanted to grow our family even more, and because we were so lucky to have a few frozen embryos, we were able to do a transfer, and now we have our son who's 19 months old, and we're a family of 3 little ones and 2 big adults, so a family of 5. Infertility is a really personal and emotional journey, and when I meet with patients in my office, it's always my goal to help balance each of their journeys and how that's going to be for them, and helping them understand that we have lots of options, helping me take into account the scientific part of what can help them get pregnant, along with emotionally what's going to balance that for them in the process of getting there. If there's a patient that's in my office that has polycystic ovarian syndrome, or I have couples in my office that are really struggling with the decision to have to move forward with IVF, I'll often share my story with them and let them know the process and the journey that my husband and I took. So now we always talk to our patients about single embryo transfer because we say one healthy baby is the best, and it still amazes me how much technology has changed in the 6 years since I got pregnant with my twins. And now we can so reassuringly tell people one at a time. The irony of what I do is I went into infertility fellowship just wanting to help people have families, and then I became the 1 in 8 that needed the help along the way. It's so common, and I just want people to know that you're not alone, and we can help build families together.